Okay. I think this John working. Try and learn a little bit more about the stream yard, Maybe try to go live a little bit more. I kind of like that live feel. It's like we can interact with each other. Right now, I'm still building it, of course. Still building it. So it ain't going like a show, but we're gonna get there. We're gonna get there. I got faith. I got faith. You know what I'm saying? It's a beautiful Sunday morning. So I'm out here putting in the Lord's work. Just keep on putting in the Lord's work. And it's gonna keep paying off. It's gonna take some time, of course. It's gonna take some time. But hey, somebody gotta do it. Somebody got to do this, man. It ain't easy, but somebody gotta do it. That's all I'm saying. Like, I'm just gonna keep on grinding. How y'all doing though? Everybody's great. It's great living well. Blessed as always. Blessed and highly favored. You know what I'm saying? So today it's gonna be like I seen a story that I just want to go over. Cause I feel like this story has been hidden for real. It's been hidden, they buried it, but I'm about to bring it to the light. Let's go ahead and get right into it. It's gonna be like I said, I'm just testing the waters, see how this joint work. But let's get it cracking. Let's go. There we go. That's what we looking for.
Your corner, in your corner. This is WJZ News at 11.
Mass overdose. A suspected bad batch of drugs sweeps through the streets of Baltimore, leaving rescuers scrambling and more than 24 people hospitalized tonight. Welcome into the news at 11, everyone. I'm Rick Ritter. At least 25 people were rushed to the hospital after being found unconscious in city streets. That is a number that sources tell WJZ is only expected to rise as the hours go on.
That's terrible. I ain't never heard of nothing like that. 25 people overdosing. And I don't even know why they even call it an overdose because it's clearly bad drugs. You know what I'm saying? I feel like an overdose should be saved for I guess, when somebody did too much, like you might have did too much. So your heart gave out or something. You might have did too much so you ain't able to function and but I feel like when you get bad drugs, it needs to be labeled as something else because overdose is misleading.
WJZ on your corner in West Baltimore tonight. Caroline Forback live with more on what happened in West Baltimore today as some people were left in critical condition. Caroline, good evening.
Good evening, Rick. I spoke with
Looking into
some of
this
the peer
overdose.
advocates in that area. And Rick, these people see substance use almost daily. And all of them told me they've never seen anything like this. And while it is unconfirmed, some of them say they believe this drug was laced.
Yeah.
It was real sad to see them people over there on the ground while they was working on them from the overdose.
Around 9:20 in the morning, fire crews and paramedics responded to several reported overdoses at the intersection of
Dang, 9:20 in the morning though. That joint must have just hit the block early, hit the block fast. They had to just put that out there, like, let's get this tested, because I wouldn't think people would be overdosing that early in the morning, but when you gotta have it, you gotta have it.
Pennsylvania and North Avenues. They found multiple people unresponsive.
Along North Avenue, along Pensy, both subway platforms, and then kind of off the beaten path down some of the alleys.
Bernard Nelson,
This is
a recovery
crazy.
coordinator at Penn North, told WJZ some of the people were able to be helped with Narcan, but more than 24 were hospitalized, at least 5 in critical condition.
This is the worst that's ever been on Pennsylvania Avenue in 29 years.
Nelson, who sees drug activity in the area on a regular basis, says he believes whatever they took was laced.
Really,
Trying to tell y'all, man, we living in some crazy times right now. People's like, oh, it used to be bad back in the day. Yeah, it might have been bad, but God, man, 25 people overdosing in the morning time. Think about how chaotic that had to be for the EMTs. There had to been madness, like getting call after call, like, hey, we need you to bring over the Narcan. Hey, where you at? Take this guy to the emergency room. This guy we about to lose him. Then Man, it's a lot. It's a lot. It's a lot. It's an epidemic. It's crazy out there. I'm trying to tell you.
Basis says he believes whatever they took was laced.
Really, it was some kind of poison where people was
Yeah.
getting, and they overdosed from it.
Emergency crews closed off the area, now an active crime scene, as officers spoke with witnesses and reviewed camera footage. Groups like the Mayor's Office of Overdose Response and Community Peer Project were also on site to provide harm reduction supplies and offer support.
I have never, and I've been doing this work for a long time. And also, like I said, I have my own story. I have never seen anything like this. Never.
Dang. We thank her for doing her work. And we all got our own story. With drugs, it's like it's a never ending process. It's like you're gonna be an addict forever, some of them say. But it's hard because we want to stay clean, want to stay sober. Yes, we gotta stay sober. We gotta stay sober. But like she said, she ain't never seen nothing like this. So we want to bring awareness to the game. Like, man, it ain't like it used to be where you could go out and enjoy yourself, get high, get your nose dirty, do whatever it is that you do, and just come back and party and shake it off the next day. Man, these drugs are taking lives. I done had some loved ones, some real close family members, some friends, some schoolmates. They fall victim. They fall victim to this drug game. It ain't the same. Leave it alone.
I felt sad. This is my community.
Yeah.
This is even my neighborhood. So I felt
Right.
really sad.
And the mayor's office said anyone potentially impacted should call 911 to seek immediate care. Additional resources are available through the 988 helpline. Reporting live here on your corner in Baltimore, Caroline Forback for WJZ.
That is a heartbreaking and disturbing story. Caroline, thank you. Because of all of this police activity, the Penn North Metro subway station, that's going to be closed until tomorrow morning at 5 a.m. MTA says you should use the Upton or Mondawmin subway stations instead and try to use the CityLink bus service afterwards if you need.
Dang. I mean, that's hard times, man. Like I said, the effect that drugs is having on the community is crazy. They can't even have a metro going because there's so much chaos right there right now. Man, we gotta do something to stay sober, keep these people sober. The reason why they getting high is because they ain't got nothing to keep them alive as far as hope, man. Hope. Let's go to the comments. It says, one of the dealers probably gave out a bunch of testers from a bad batch. Just wild. Yeah, I agree. And he probably sitting there nervous. Yeah, because he knows somebody out of 25 going to say something. Whatever he was trying to do, they messed that up. So same streets, same corners for years. Y'all ever going to just not allow open air drug markets? What are they to do? Let's be honest. What is it that they can do? There's nothing that anybody can do. You lock one dealer up, the next one's coming back. That's just the way the game goes. But Baltimore is so safe. Yeah. Do we expect anything else to happen to addicts? I mean, we would hope that at least if they're going to get high, that they can survive, man. It's so sad. The same thing was in the episode on Grey's Anatomy, season 16. Somebody says, I'm not sorry for any of them. They're a bunch of lost people. Well, I mean, sure, if one of your loved ones was lost, you would want them to be found. So we can't have that kind of mindset. Let's see if we can find something else, because you know what I mean. It's crazy. Oh, some more Baltimore stuff. All right, we're gonna dive into this one. Y'all ready? Y'all ready? Let's get it. Let's go ahead and make that happen.
Baltimore police responding to multiple locations across the city on Saturday involving large dirt bike gatherings.
Oh.
Dirt bikers were racing by up and down the street, through traffic, onto the sidewalk.
I ain't gonna lie, they be doing their thing out of Baltimore. DC too. Yeah, I went out there one night, and man, it was like 30 of them. Like, yo, it's crazy. The police is going one way. They ain't even paying the police no mind. There's so many of them. There's nothing that the police can do. Like, they just control the streets. Every now and again, you hear about one of them crashing or doing something wild and somebody getting hurt. But for real, they deep in that zone. They be doing wheelies and skirt. But I mean, it can be scary for a citizen to see all these people on dirt bikes. It look like Mad Max. You feel me?
Well, residents say this problem has been going on for far too long, and now they have lost hope that anything will ever change. Fox 45's Vincent Hill joins us live with their concerns tonight. Vincent.
Well, Maxine, no matter where you were in the city on Saturday, you likely saw or heard dirt bikes, and police could only watch and try to break up the crowds. On Saturday, in the shadows of flashing blue lights in North Baltimore, came the roar of dirt bikes.
50 to 75.
Dang, yo,
As the day went on,
that's
that number
crazy.
only got bigger.
And it is a good time by like 100 dirt bikes all by now.
Come on, man.
Blocking basically the entire roadway.
The trail of dirt bikes expanding.
Bro, they are deep and it is broad daylight out there. I thought it was like 20 or something, 30, 40. They said 70 people on dirt bikes. Look, the police right there, right there. You don't see no police out of the cars. There's nothing that they can do. Like, they run the city, hell. They run the city. That's just what it is.
Across the city, most of it being posted to social media. Look here, as a crowd of dirt bikes take over Druid Park, police vehicles can be
Yo,
seen
they
in
are
the distance
deep.
as Foxtrot, BPD's aviation unit, is circling overhead.
A regular hot day in Baltimore for you.
This social media
I ain't know it
post
was like
shows
that.
the band of dirt bikes near downtown.
If y'all would have seen the beginning, like, oh my God.
Following
Nah, I did not know they was getting busy like that. Yo, they sliding through like the military over that jump. Like, how many people got dirt bikes in Baltimore? Where are they even storing all these dirt bikes? Like, how are you hiding it? For real, this is crazy.
Seeing the beginning, like, oh my God.
following close behind a Baltimore police car. As the night went on, so did the encounters between police and dirt bikers. It was just 2 weeks ago that Federal Hill residents predicted Saturday's street takeover during a public safety meeting.
We've got June, July, August, September, October with a lot of the dirt bikes.
In that meeting, frustrations were boiling over as dirt bikes had already started becoming a problem.
I mean, have y'all thought about like spike strips? Just throw them down and let the dice go where they may.
Residents say they've lost all faith in city leaders to fix the problem.
So if you have a mayor that calls it a cultural institution, we're doomed.
Fox 45 has pressed Mayor Scott countless times.
Oh yeah, they trying to run y'all up out of Baltimore. Did you see that that city hall meeting or whatever it was? Yeah, they trying to get y'all up out of there. They ain't happy. No. Gentrification, saying no to the dirt bikes. Is you crazy? As much money as I'm paying for this joint out here in Baltimore by the harbor, and y'all riding y'all dirt bikes through there, making all this noise, playing all that boom bop bop hip hop music and rap and trap and drill. Oh no, man, they about to crack down on that. Let's see how they want to throw spice out. I don't think that's gonna help, but let's see.
On dirt bike enforcement are questions usually turning into heated debates.
Dirt bike enforcement is not just about young people. I want to be very clear about that. If you or anyone else thinks that everyone that rides their dirt bike is a teenager, then you need to know a little bit more about dirt bike culture. We will continue to enforce the laws on the book.
Meanwhile, residents say they haven't seen much when it comes to that promise from the mayor.
I used to feel, in conclusion, that the city was dysfunctional. I've almost reached the point now that it's non-functional.
He trying to carry it.
And that rain earlier today certainly didn't slow down dirt bikers. There were several reports across the city. I actually encountered some near the Inner Harbor on the way here. For now, we're live at BPD headquarters. Vincent Hill, Fox 45 News.
Hi, I'm Maxine Stryker. Thanks for watching. Don't forget to like this video and subscribe to our channel and check out Fox Baltimore on social.
Yeah, but there you have it, man. There you have it. Baltimore is tripping. You ever been to Baltimore? You been to Baltimore, chat? That's how they say it, right? Let's say it, right? Reaching out to the chat. But I mean, there's a lot going on all over the place for real. I'm sure there's other places other than Baltimore and DC having their dirt bike frenzies. But I'm gonna see what else I can find. Actually, I gotta get used to streaming. It's not easy. It's not easy being up here just talking. I'm not a social guy, so this seems interesting. I got another one for y'all. We about to react to this joint in real time. This seemed really interesting, actually. Let me go ahead and drop that.
Welcome back. We count on them during our worst moments, but many of us don't realize the constant threat faced by healthcare workers. Savage attacks from the very people they're trying to help.
That's right. Healthcare workers are 5 times more likely to be injured by violence on the job than any other lines of work. Senior investigative reporter Lisa Fletcher has reported on this for years now, and now she's asking why more hasn't been done to protect our critical caregivers.
Wow. I mean, I ain't never know that. I mean, yeah, I guess so. Healthcare workers having issues with their patients. I know, like, when you work at like a retirement home, sometimes the elderly patients, they're going through things mentally and their mind is starting to deteriorate. So they put up a little bit of a fight. They might cuss at you, spit on you. But I want to see what other kind of stuff they talking about. 5 times more. That's interesting.
Patients in emergency room triage are at their most vulnerable.
This is the room where I was assaulted.
But it is doctors and
Oh,
nurses
wow.
across the country who are increasingly finding themselves defenseless to violent attacks in those safe spaces.
She basically
Hold
stood
on,
up,
run that
punched
back.
me,
I hit
and
the
I
wrong
did
button.
fall off my
spaces.
She basically
defenseless to violent attacks.
This is the room where I was assaulted.
But it is doctors and nurses across the country who are increasingly finding
Bro, where do you
themselves
get it back?
defenseless to violent attacks in those safe spaces.
She basically stood up, punched me, and I did fall off my chair into this desk here.
Beaten and bruised, Maryland nurse Lisa Fisher was left with a black eye and 3 stitches.
You must have been so shocked and disoriented.
Man, I mean, to be a healthcare professional and you coming home, hey, honey, how was your day? They beat on me at work. Like, that's not right. That's not cool. That's not what you get paid for. If that was the case, you know what I'm saying? Might as well go into MMA or something.
Eye and 3 stitches.
You must have been so shocked and disoriented.
Totally shocked. I had no idea it was coming.
I'm trying to get help.
But those unpredictable attacks are
Sure
happening more often than you might think.
It is definitely on the rise. And it's not just here. It's not just my county or Maryland. It's nationwide.
Where is the injured nurse? The nurse is in the floor.
This Florida nurse was nearly beaten to death by a patient. This Pennsylvania gunman used nurses as human shields. And these are the faces of doctors recently murdered at work in Oklahoma and Tennessee. And it's getting worse. In
Rest in peace to those doctors, man. Rest in peace to those doctors. You get murdered at work. We don't hear about this. I ain't hear nothing about this, man. You hear about the crazy stuff that happens at the fast food restaurants that say stay away from fast food, but what about the crazy stuff that's happening in hospitals? And I actually heard about the EMT that got stabbed, which was horrible. You know, somebody was on some kind of drug binge and they get up and they just want to stab the EMT. And, you know, the EMT trying to help. The EMT got a family to go home to. And man, I don't think nobody gets paid enough for this.
at work in Oklahoma and Tennessee. And it's getting worse. In 2015, a survey found 47% of emergency room doctors and 1 in 4 nurses reported being physically assaulted at work. 10 years later, a staggering 91% of ER doctors and 80% of nurses report violence on the job.
I can say, just in hospitals that I'm aware of, we've had, more than 6 incidents. Several nurses have been hospitalized. hospitalized. Several nurses have not been able to come back to work or have had permanent impairments. And that's just really in the last 2 or 3 years.
Only a dozen states have laws requiring healthcare employers create workplace violence prevention plans. Just this month, Virginia joined that list, requiring hospitals to create a system to document and track violence.
What's taking them so long? Man, you know you got disgruntled patients. They acting all belligerent, putting their hands on people, and there's no kind of consequences beside, oh yeah, they're having an issue. Yeah, I tell you what. Let me be at work as a medical assistant, a phlebotomist, or something, because that's what I went to school for at one point in my life. Right now, I'm doing personal training. I like to keep my body nice and like to help people keep their body good. But if you coming at your own tripping and you put your hands on me, you talk, it's going down. You ain't got to call the police. You ain't got to worry about none of that right there. It's going down. I'm trying to tell you. And I feel like more people should be like that. You know what I mean? Don't worry about losing your job. Beat the brakes off of that person. You know what I'm saying? You got to beat the brakes off of that person. They want to trip on you, trip on them.
There have been attempts at the federal level to protect healthcare workers, but none has become law.
When you look closely, this has become a real national crisis, really.
Maryland's U.S. Senator Chris Van Hollen is co-sponsoring a bill that requires healthcare employers to create a violence prevention plan.
In 2021, a similar bill had 145 co-sponsors.
Yeah.
In 2023, a similar bill had more than 170 co-sponsors. Yet both times it got derailed. Where do you think the hiccup is?
Well, there's some folks that just don't like the idea ever of putting in place sort of workplace safety regulations. They prefer sort of a free-for-all environment. I think that's a mistake.
Who needs to buck up and who's been...
I'm trying to tell you, it ain't going to be free for all when they start whooping on everybody, just putting hands and feet on everybody, because as a medical professional, you shouldn't have to worry about this, man. And they don't want to put laws into place. Like, what's going on in America? We got to get this stuff together.
Preventing action up until now.
Well, we'll see. We've introduced this piece of legislation. We hope to get it over the finish line. We unfortunately, do not have, strong bipartisan support at this moment.
All right, I'm just going to put this on your arm.
Nurse Lisa Fisher says she's doing her job.
We're almost there, almost done.
It's time for Congress to do theirs.
We are here to help people. We are nurses that get into these unpredictable situations that are sometimes, out of our control. But being assaulted is not part of our job.
There's also legislation being floated in both houses that would make it a federal crime to assault a healthcare worker on the job. That appears to have bipartisan support. We're keeping an eye on it. Michelle?
Lisa, obviously there's a tremendous cost in pain and suffering, of course, to those involved. But any sense of the wide-ranging financial cost to these attacks?
Actually, yes. There's a new report that just came out from the American Hospital Association, and it found that the annual financial cost of violence at hospitals was upwards of $18 billion. And it doesn't stop there. Healthcare workers in the field may be at even greater risk. We're working on some new reporting on that. It's going to be coming up in the weeks ahead.
See the healthcare workers in the field at that EMT that I was speaking of. That's got to be dangerous, because you pulling up to the spot, not knowing what's going on, not knowing who you about to encounter. And then the next thing you know, there's a weapon present, or they're going through fits. And that's why sometimes, like, it's tough. It's tough. Police, EMTs, firefighters, like, hats off to them, because they put their lives at risk every day and don't know what's about to happen. These people are assaulting healthcare workers. You know what I'm saying? Like, the world is crazy, y'all. Like, working with the public now is very dangerous. It's very dangerous. You never know what to expect. You never know what to expect day to day. So if you work with the public, we salute you and we thank you, because they're crazy. They crazy, for real, for real. But shoot, thanks for hopping on. I'm probably about to hop on again in a little bit. See how this junkie is shaking. Lift some weights or something. Eat some salad, some fruits and veggies. Drink my water. try to get on top of the game right here. You know what I'm saying? It's about to be August. Sheesh, this year going by fast. You know, your boy was born in August, so it's countdown time. Trying to be the best version of myself. Keep that 6-pack popping. You know what I'm talking about? But hey, y'all, I'm gonna be back. We're gonna tap in a little bit later. Be easy.